This is a 3D scene depicting three different lumbar vertebrae, L1, L3, and L5. From a superior view, the bodies are large and kidney-shaped with a concavity facing posteriorly. On the posterior rim of the superior end plate of the vertebral bodies, there are small elevations that represent remnants of the uncinate processes of the cervical region. The lumbar vertebral bodies are wider from side to side than from anterior to posterior or front to back. The L4 and L5, in this case L5, present taller bodies in the front than in the back, and that has a significant impact for the lordosis of the lumbar region. 90% of the compressive load received by the vertebral bodies are carried by the inner cancellous bone, just in the center of the body. Moving posteriorly, labeled as number 2 here, number 3, and number 4, we can identify the strong and short pedicles that are part of the lumbar vertebral structures. These pedicles, again, are short and they're attached a little bit more inferior to the body than the ones in the thoracic region. They have two notches. One is a superior notch and an inferior notch. The inferior notch tends to be more prominent than the one that lies superiorly. From a superior view, we can see that there's an actual orientation that is going to change as we move towards lower levels. Usually at the level of L1, there's an actual angle of around 5 degrees that increases 5 degrees for each one of the segments, ending at approximately 25 degrees with a 25 degrees action angle for L5. Now labeled as number 7, we see the transverse process of L1. The transverse processes of the lumbar vertebrae project posterolaterally from the junction of the pedicle and the lamina. The lumbar transverse processes are long, and if we see the three of them, the transverse processes of L3 are the ones that have the longest transverse length, that lie around 5 centimeters from the midline. Now there's a feature that is unique for this transverse, for this region, which is a prominence that emerges from the posterior and inferior portion of the transverse process at its junction with the lamina. This is the accessory process. The accessory process serves as an attachment site for the longissimus thoracis and the medial intertransversal lumborum muscles. Now labeled as 9, we see the superior articular process. The superior articular processes are similar to the thoracic region in terms of their vertical orientation, and from a superior perspective, we see that their orientation changes from oblique or sagittal to a more coronal orientation in lower levels. There's also a bony prominence emerging laterally, which is the mammillary process. So the mammillary processes are characteristic posterior projections from the superior articular processes of lumbar vertebrae, and they serve as attachment sites for the multifida lumborum muscles. Inferiorly, we have the inferior articular process that fits perfectly into the posterior and medial concavity of the adjacent superior articular facet. And in between we have the pars articularis. Medially, we can see the ipsilateral lamina. So the laminae of the lumbar vertebrae are broad and thick, but do not entirely overlap one another. In contrast to the thoracic region, a distinct space exists between the lamina of adjacent lumbar vertebrae. We see also how this changes in terms of their more vertical orientation to a more horizontal orientation in lower vertebrae. From a superior perspective, we see the vertebral foramina that let's change a little bit the view here to appreciate better the shape. So the lumbar vertebral foramina are triangular in shape, although they're somewhat more rounded in the upper lumbar vertebrae and more triangular in the lower lumbar vertebrae. And let's finalize with the spinous processes. The lumbar spinous processes are broad from superior to inferior and narrow from side to side and project directly posteriorly. There's a posterior inferior ridge which is thick, and it serves as an attachment site for the thoracolumbar fascia, supraspinous and interspinous ligaments, as well as deep back muscles such as the spinalis thoracis, multifidus, and interspinalis. The size of the spinous process tends to get smaller as we move towards the lower vertebrae, and that's the overview of the lumbar vertebrae. The sacrum is a large and complex triangular bone situated at the base of the spine. It forms the posterior wall of the pelvic cavity, and it presents 6 different surfaces: a superior base, an inferior apex, 2 lateral surfaces, a posterior dorsal surface, and an anterior pelvic surface. It articulates with 4 different bones, superiorly with L5, inferiorly with the coccyx, and the ilium part of the hip bones on each side. The sacral promontory articulates with L5 to form the sacrovertebral angle, which is an angle of about 30 degrees from the horizontal plane that provides a useful marker for different lumbosacral procedures. There are 2 lateral projections coming out of the base of the superior end plate that are called the wings of the sacrum, or the alae. The alae articulate with the sacroiliac joints, and these alae support the psoas major muscles and the lumbosacral trunk, which connects the lumbar plexus with the sacral plexus. Over the anterior surface or pelvic surface, we can notice the body of the first sacral vertebra, the second, third, fourth, and fifth. Each body is fused and has a crest at the place of their fusion, which is a transverse ridge. Laterally, there are anterior sacral foramina, total of 4 foramina that have decreased in their diameter as we move towards the lower levels. Again, laterally we have the auricular surface, which is for its side is going to be the place for the articulation with the alien part of the hip bone. Superiorly, with this, we see the sacral canal, which is the continuation of the spinal canal or vertebral foramen. And we see the only articular process that is not fused, and that is gonna match the inferior facet of the inferior articular process of L5. Again, the ala and a median crest. We see that the medial crests are the remnants of the spinous processes, in this case from S2 to S4, with S5 not having a median crest. There's an articular crest which is also created by the fusion of the articular processes. And there's a lateral crest, which is the place for the attachment of several pelvic ligaments. We can also identify the posterior sacral foramina, which, as well as anterior, they're the place for the exit of neurovascular components. Anteriorly, the ventral nerves, and posteriorly the dorsal nerves. And lastly, there's a place for the articulation with the coccyx, which is called the cornu, and is an inferior prominence that comes or that follows the median crest. And that's an overview of the sacrum.